Bismillahirrahmanirrahim. So, in this lecture, we will discuss about the pressure ulcer. Pressure ulcer, also known as pressure sores, bed sores, and ulcer decubitus, most commonly presented in the older age patient. Let's discuss this with a scenario like an 80-year-old male patient presented to the OPD with a grade 2 pressure ulcer at the sacrum of the body. So basically, the pressure ulcer is usually formed over the bony prominence, and sacrum is the most common bony projection where the most 37% rate of the development of the pressure ulcer. So, like the tailbone ends over the hair, and there are two parts of the tailbone: sacrum and the end projection, which is coccyx. So, sacrum is the tailbone where the bone exerts more pressure over the skin, and skin is usually contacted with the mattress or over the surface of the bed. So, basically, the bed exerts pressure over the skin, and underlying the bone exerts pressure of the skin, and in between the skin, the tissue gets damaged because of the both pressure, and there is a sore form over that bony projection, which is labeled as pressure sore or bed sore. So, by definition, a pressure ulcer is an area of localized tissue injury. Localized tissue injury which occurs as a result of compression between the bony prominence and the external surface. And external surface is the mattress, bed, or any bedding wherever the patient is usually bedridden or immobile. So, when the pressure ulcer form, uh, so basically when the skin is continuously in between the pressure of the bone or over the bed or over the chair or continuously immobile more than 2 hours, then the mild erythema formed over that respective area, which is labeled as grade 1 pressure ulcer. After 2 hours of continuous immobility, the grade 1 pressure ulcer develops, and if this immobility persists, then this grade 1 turns into grade 2, and if it left untreated, then this grade 2 turns into grade 3 and grade 4, and some suspected pressure ulcers as well. So basically, the pressure ulcer is usually formed over the bony prominence when the pressure is continuously persist more than 2 hours, and this happens in normal healthy young adults as well. Like we are in a sleeping position, and if we are continuously in a sleeping position more than 2 hours, and we wake up suddenly, then we feel that our arm is totally numb, and there is no blood flow in that arm as well. And so that is why there is a pre-designed system in human body that due to proprioception, the human body is continuously in a state of mobility or in a state of moving position while sleeping as well. But the older age patient or chronically ill patient does not have this ability to move themselves because of their illness, because of their aging. So they need some external help to move their body, and that is why the pressure ulcer form if the patient continuously remains in a state of immobility for more than 2 hours, and this pressure is usually formed over the bony prominence. Okay, so there is some statistics which shows the where the most common pressure form. So the pressure ulcer is usually formed over the sacrum, which is a tailbone, which we have seen in our second slide as well. The second area of pressure ulcer is heel, where 30% chance of the formation of the ulcer at the heel bone. Ischium is a bone which is present in the pelvic girdle, elbow. Malleolus is also present at the site of the ankle. Trochanter is a bony projection at the femoral bone, knee bone, scapula like the shoulder bone, and occiput at the back of the skull. Like the patient is bedridden, and the pressure where the most common pressure exert, like back of the head where the occiput bone is present, shoulder with the scapula, elbow, lower back and buttock, which is where the sacrum, major trochanter and ischium bone is present, and the hip bone, inner knees, heel bone, and at the side of the ankle is malleolus. And these are the areas where the bone exert pressure over the skin, and the skin and meanwhile the bed and mattress exert pressure over the skin, and in between the skin gets damaged with loss of tissue. Like from this, the bone is exerting pressure over the skin, and the pressure from the mattress is also exerting pressure over the skin, and the skin and muscle layers gets compressed, and when the skin gets compressed, there is a loss of tissue damage due to loss of oxygen, due to poor blood supply. And when the tissue gets damaged, then the grade 1 pressure ulcer form in the form of mild erythema. And if it's left untreated and if the patient remains immobile, then this grade 1 turns into grade 2 with damage to the whole epidermis. And if this still persists, then this grade 2 turns into a grade 3 with damage to the epidermis and dermis, and the grade 4 is full thickness with damage to the subcutaneous tissue as well. So there are different causes of the pressure ulcer. Like let's understand this from the pathophysiology. Okay, there are some intrinsic and extrinsic factors. Intrinsic factors like age, blood disorders, nutrition, and some other illnesses like diabetes, hypertension, dyslipidemia, smoking, vascular diseases, edema as well. So basically, the major intrinsic factor for pressure ulcer are mobility changes, which is basically the chair bound, bed bound, and walking with a limitation. Vascular perfusion, in which the blood flow gets abnormal, or the loss of the blood flow due to tissue damage, in which the diabetes, hypertension, smoking, edema is formed. And skin pressure ulcer status, in which the redness, erythema, and dryness formed over that respective area. Okay, there are some very important extrinsic factors in which the number 1 is the pressure, number 2 is the friction, number 3 is the shear, and number 4 is the skin microclimate, and which is more understandable with this picture. So basically this is the tissue, which we can like tissue of the skin, and there is a bone and there is a sport surface. Sport surface is like the bed, mattress, chair, and walking with the limitation. So the bone is exerting pressure over the tissue. The skin so the bed, mattress, or any external surface is also exerting pressure over the tissue, and the tissue gets damaged and the pressure ulcer forms. So this is one of the main factor. The second factor is the friction. In the friction is actually is in that case the tissue is exerting pressure in that linear position, and the sport surface is also exerting pressure in that linear position. So friction is the scenario in which both of them is exerting pressure in the same direction. And the third factor is the shear force. In the shear force, the tissue is exerting pressure in that position, and the sport surface is exerting pressure in the that position, and the different pressures exerting over the skin cause the tissue damage over that respective area. And the fourth factor is skin microclimate, the moisture which is present over the bony prominence. So basically whenever there is a moisture present over that bony prominence, the temperature usually get increases, and every 1 degree Celsius rise in skin temperature in speed up the tissue metabolism by 10%. So there is a more chance of also formation of the pressure ulcer when there is a moisture present over that respective area. And this moisture can come from the perspiration of the urine, feces, fistulas, and the skin macerations as well. So basically these are the most important causes of the pressure ulcer. Okay, there are some stages of the pressure ulcer, as I have already mentioned. So let's sum up with these stages. Okay, according to National Pressure Ulcer Advisory Panel staging system, basically there are 4 main stages of the pressure ulcer, and there are some 2 unstageable pressure ulcer. The first stage in which the mild erythema is formed, and this erythema is damage to the tissue, which is this erythema is non-blanchable redness of a localized area of usually a bony prominence. The second stage in which the epidermis gets damaged with some loss of the dermis as well. So basically, partial thickness loss of dermis presents a shallow ulcer, and there can be some blisters form over the area. And this ulcer usually it can be present with any type of the wound like e-scar, necrotic, slough, gangrenous, or any type of the wound if it's left untreated. Okay, so the third stage is a complete loss of the dermis, and also we can label it as full thickness skin loss, and in which the subcutaneous tissue or fascia can be visible, and bone, tendon, or muscle cannot be exposed in this scenario. And the fourth stage in which the subcutaneous fat also gets damaged, and we can notice the bone and tendon if we debride this wound. Okay, so there are some two unstageable pressure ulcers. Unstable pressure ulcers in which there is a suspected deep tissue injury, in which the some like hemorrhages and ecchymosis like skin is formed over that respective area, and this skin is usually formed due to feces and urine maceration or humidity as well. And the last stage is unstageable, in which the doctor usually doesn't diagnose, like it's a stage 3 and stage 4, so they label it as unstageable pressure ulcer. Okay, so basically, till now we have discussed that the pressure ulcer is formed due to pressure, friction, shear, and skin microclimate. So, if our patient is immobile due to like her age, due to some chronic illness, due to hospitalization, due to some other diseases which restricted the patient mobility, then we need to prevent the causes of the pressure ulcer. And we know that the most important cause is the pressure, so we need to insert some beddings like ripple mattress, which reduces the pressure over the bony prominence. So the number one prevention is the to add the ripple mattress over the patient bed. Second factor is the skin microclimate, in which the moisture formed over the bony prominence exerts some unpredictable factors over the bone and damage to the skin. So to prevent the moisture over that respective area, it is usually recommended that the patient usually not wear a diaper, and the patient usually hospitalized with some dignity sheets. The dignity sheets works up like a diaper, and if and we have to usually cover the dignity sheet from both the lower side and from both the upper sides. So basically, there is no pressure of the diaper as well, and the patient is also covered, and there is no amount of the moisture can develop at that respective area. Okay, this is the second cause. So the third cause is the nutrition. The poor nutrition, which is usually due to diabetes, the patient usually prevent her the blood glucose level by preventing some necessary foods as well. So basically, the patient nutrition or high protein diet is very essential for the patient's skin, and like albumin or some other proteins are required for the patient, which prevent the chances of the pressure ulcer. So these are some important causes, and these causes should be prevented at early stages to prevent the formation of the pressure ulcer. In other scenario, the pressure ulcer, if the patient is hospitalized, then there is a chance of the more chance of development of the pressure ulcer, and if the patient if this left untreated, then it can lead to infection of the deep tissues and bones, which can lead to sepsis or necrotizing fasciitis. Okay. So that is why we need to prevent the pressure formation of the pressure ulcer in early stages, so we can get rid of the formation of the pressure ulcer. Yes, we use some correct positioning devices which makes the patient mobile, like draining tubes, catheter, and braces. And we can use some medical devices or ripple mattresses as well to make the patient mobile after every 2 hours. And last is a support system. Support system is usually with a bed, mattresses, overlays, and wheelchairs as well. Like in this picture, this is a picture of the ripple mattress, and like we can see there's a bubble over the ripple mattress, and due to which some less pressure exert over the patient skin. Okay, so finally, if the pressure is ulcer is formed, then what do we do? So basically, the pressure ulcer is, over the bony prominence, the patient should be in a mobile position after every 2 hours. Like the caretaker should change the position of the patient after every 2 hours. So basically, this is the first cause of the management of the wound. Second cause is to continuously clean the wound and cover it with some topical antibiotics. And if there is a formation of deep infection, like some oral antibiotics should also be given in these patients as well. And there is a high chance of some bacterial, fungal, and pseudomonas infection over that respective area. Then the doctor usually prescribe the combination of topical antibiotic with some topical antifungals with some gentamicin, like to cover the wound with every type of bacteria, fungi, and pseudomonas. So basically, this is the common management of the pressure ulcer, and rest is upon the indication the patient is presented. And lastly is to clean the wound. The wound should be cleaned with the normal saline. We can also clean the wound with some simple tap water, and always clean the wound like soap, mild soap, and with the tap water. And there is a chance of, yes, there is a chance of some bacteria, fungi, and pseudomonas infection. So the wound is or should always be covered with some combination of topical antibiotic, topical antifungal, and some gentamicin as well. So that's all about the pressure ulcer. And you can also study it in detail from the Rook's textbook of dermatology. And thank you so much.